Good evening. It's April 7th, 2020. Dr. Noel Williams, Optimal Health Associates. Update on COVID. We have about 1.4 million people infected in the world, about 80 some thousand deaths in the United States, almost 400,000, and about, I think, 13,000 deaths. Again, the numbers blend. In Oklahoma, about just shy of 1,500 and about 67 deaths. And again, a lot of those numbers are a little bit inaccurate or underreported. But the good news is we're getting organized in Oklahoma. I'm sounding like a pretty solid Oklahoman. We're getting Oklahoma. We're getting ready. So we had a great conference call today with our inter-hospital community organization group with Secretary Shrum, Casey Shrum from OSU, wonderful speaker, and has a complete clue on the management plan, and Dr. Larry Bookman, OSMA president, who has been forging relationships between state entities, the licensure boards, to get things organized so nurses and doctors can float between places or facilities that need help. A big shout out to Chuck Spicer, CEO of OU, who has really endorsed so many things to make our state better. Another shout out to Richie Splitt, CEO of Norman, who has also helped. And again, all the administrators at Midwest City, Integris, Mercy, the Oklahoma Heart Hospital, all amazing. If I'm missing someone, I'm sorry, but there's this great group of hospitals that are doing everything they can and we're collating with the state, and we had a great meeting. So what Secretary Schutt said today was, things are organized. They have 4 pillars of excellence for the state. They have them working. They're coordinating logistics, information, and how to get things from point A to point B. If, let's say, Tulsa gets hit worse than Oklahoma City or Muskogee, they can get all of these things coordinated. Very impressive plan, and you can tell the innumerable work hours these people have put in. So I'm very, very impressed. And it was a great phone call, and I want to thank her very much for taking the time out to speak to a group of the Oklahoma City leadership group on hospital care. Other updates, the current data shows that the wave is anticipated to hit somewhere after April 20th, and between April 20th and April 30th. That's when we're going to really be a little more hard pressed. We'll just have to see how that goes. I think sheltering in place now, staying at home, isolating, masks, washing your hands, keeping distance, all matters, and it matters more now than it's ever mattered, because we want to break the wave. An additional thing to think about is I've had a lot of texts and calls from support staff at hospitals. They're sometimes a little more direct about how things are going than other people, and so what I've heard is they need supplies. It doesn't matter if it's OU, Saints, Integris, Mercy, Norman Regional. There's a limited number of supplies available for the staff. And so what they really need is masks. If you have any personal protective equipment, please give it in. If you have 50 N95 masks right now because you've been a carpenter or a painter or something, bring 40 of them in. You're not gonna go through 10 of them in the next year because you're doing carpentry or painting. It's okay. All these nurses, all these support staff, these physicians need this stuff. Some of the facilities are having to start sterilizing non-reusable equipment or personal protective gear because a re-sterilized piece of protective equipment is better than no protective equipment. But why don't we change that dynamic in Oklahoma? Let's have people donate everywhere. Think about the big facilities. They have more staff, and the other thing is they're also having more sick patients. So let's donate to them. So that's the main messaging tonight. The state's organized. The hospitals need stuff still, and we're in good shape for the coming surge. We need to do our core things, which is staying at home, sheltering or safety in place, You need to keep social distancing, which is closer to 20 feet than 6 feet if you're inside. Third, you need to use a facial covering or a mask. Fourth, you need to wash your hands 3 or 4 times as much as you think. And the final thought tonight is let's acknowledge the nurses, respiratory therapists, and all the support staff at the hospital. If I'm as a physician, if I go around on someone, I may spend a few minutes with them. But who does all the work? The nurses do all the work. They're going to spend, for every minute or two I spend with the patient, they're spending 15 to 20. And there's no more greater illustration of this than with COVID-19. Who's doing all the bedside care? Who's doing all the tough stuff? Who's helping them with their breathing? Who's resetting the ventilator? Who's irrigating the ventilator? Who's coming in to help them? The respiratory tech, the janitorial staff. There's all these people who are making the plan happen, and they deserve the most credit for this. So be very respectful to these people, pray for these people. They're all putting their lives at risk, but more importantly, show up and give them what they need. Give them some disposable N95 masks, give them, if you have any personal protective equipment, bring it all you can to the hospitals. Being a miser about it now doesn't help any of us. So we're doing great. The state's organized. I'm very impressed with everyone. A big shout out to David Chansom, who was with the governor today at his press conference, infectious disease expert out of Integris. He's the bomb, and he's doing the job that we all wish we could do and contribute at his level. So thanks to my staff, for my manager for tolerating me through this stressful time, because I get a little stressed and anxious dealing with all these different groups and trying to organize and move us forward. So a big thank you to my staff, my wife, my children, and everyone else. Good night.